So how are we doing on the artificial intelligence and mental health front? Well, I actually recently wrote a blog post on this on Charm EHR's website, and it's actually becoming more and more talked about now recently. There was an article in the Wired magazine, and it's now being dubbed good enough therapy, and that gives the illusion of help because you're actually not getting very good help. It might help some people who have very mild mental illness or maybe loneliness, and it gives them somebody to talk to, but if you actually have any sort of issue, mental health issue, you really should be talking to an actual person. I don't think that AI is actually ready for this task yet. Words can be used in slang, they have alternative meanings. The meaning of a sentence can change depending on a patient's history, cultural values, their gestures, the prosody of their voice, their tone of their voice. It's important to consider the patient's subconscious motives too. That's what we do as mental health professionals. And that's necessary in a therapeutic session because they might not be understanding what their subconscious motives are. As much as AI can detect literal meanings of words, maybe there's some use for that sense for a search engine, but in therapy it's very difficult. Even other humans don't always know what other humans are saying by their words they're actually saying. So it's very, very difficult. I think for now, bots have more potential for harm than for benefit for actually venturing in the therapy space. I think there's so much other low-hanging fruit that they could go after, such as informative tips and alerts and helping augment decision-making by reducing human error. Therapy is not where they should be right now. The practice of medicine is full of rote tasks that are ripe for opportunities to be offloaded to a computer. For example, AI has recently been applied to the evaluation of retina images, which allows ophthalmologists to focus on other areas of medicine that they find more rewarding. I think that as AI makes its way into healthcare, clinicians should not be worried about whether or not they would be replaced, but instead how their practice is going to evolve over time, hopefully for the better.